think that's really reasonable. And we could probably even put a basic blood work, or what we consider to be a basic blood work panel. So generally this is sub $200 versus a $3,000 panel. It kind of reminds me of investing. Like when you mention all the fancy, like, oh, salivary testing, urinary testing, gut testing. It's like when someone gets into day trading, right? And they've got to have a ton of indicators and spreadsheets, they're tracking all this stuff, when really they're better off just putting money in an index fund if you look at averages. So just because it's more complicated doesn't necessarily make it more valuable or better.
With that, moving on to the A tier, these are still really good interventions. They're perhaps not as OP, they're not as overpowered, but whenever you go to, and I think we talked about this in our dysfunctional medicine podcast, please check that out if you have not listened. But functional medicine, according to us, is root cause medicine. So a cookie cutter program where you get $3,000 worth of labs when you first go to the service. And regardless of symptoms, you're getting urinary and salivary hormones tested, and you're getting gut microbiome. Well, not gut microbiome. You're getting what's excreted from the gut microbiome tests, and you're getting heavy metal tests, and you're getting hair analyses, and you're getting tick bite analyses, even though you don't live in a region or you have no history of tick. Like, these cookie cutter programs are not great investments in your health. So it's okay to get lots of information and to want to dig deeper. But one of the best things that we see as an alternative to that is getting a complete nutrient and vitamin panel, both in the serum and intracellularly.
Yeah, and that circles back to one of the first two pillars, the diet. So what are you eating in your diet, and what are you absorbing, and what are you incorporating into cells? I think that's really reasonable. And we could probably even put a basic blood work, or what we consider to be a basic blood work panel. So generally this is sub $200 versus a $3,000 panel. It kind of reminds me of investing. Like when you mention all the fancy, like, oh, salivary testing, urinary testing, gut testing. It's like when someone gets into day trading, right? And they've got to have a ton of indicators and spreadsheets, they're tracking all this stuff, when really they're better off just putting money in an index fund if you look at averages. So just because it's more complicated doesn't necessarily make it more valuable or better.
Yeah, that's a good summary. On that note, we have not mentioned all the pillars of health. All the other pillars of health, including social health, interaction with family. If one of your family members is struggling with health, then that can certainly throw things off. I guess also in this tier, we could mention anything to do with the health of a pediatric patient. So you're just literally going to have better return on investment if you catch something early during childhood. For example, a percolating metabolic syndrome. If there is somebody that obviously or not obviously has metabolic syndrome at age 11, if you catch that before puberty and prevent a precocious puberty and a whole sequela of events after that, that's really good return on investment.
Yeah, again, goes back to investing as a literal process. That start early, it's always going to be better. And our other pillars of health, we mentioned sleep briefly, sleeping mask, and sleep is actually a pretty steep time investment. 7-8 hours per night for adults. You need even more if you're a child or adolescent. So it is a big time commitment, but it's something that we do need and we should prioritize. And if we look at how most people spend their day, we talked about 3 hours of exercise per week. Averages, people watch about 3 hours of television per day. So when people make the argument that I don't have time, there are some people who literally don't have time because they are busy from the time they get up to the time they go to bed, but that's a small minority of the population. So sleep, I can't stress it enough. Avoiding electronics, definitely not having a TV in the bedroom. There's been an abundance of research on this, and having a TV in your bedroom, it doesn't directly make you more likely to develop diabetes and obesity, but people with TVs in their bedroom are at a higher risk of diabetes and obesity because they're absorbing calories from the food commercials, right?
I guess so. A lot of reasons to do that. I like the 10-3-2-1-0 rule. 10 hours before sleep, no caffeine. 3 hours and 2 hours, no vigorous exercise and no large meals. 1 hour, no bright blue or bright white light, and then 0 snooze in the morning, and also attempt 0 or minimal fluctuation in the time that you go to bed and wake up, but especially the time you go to bed. And then I guess also wait 30 minutes before consumption of caffeine in the morning. So those lifestyle interventions are going to be much better than any sleeping pill. I think we briefly talked about stress in relation to family and social health, but with stress, you want to make your stress feel good. There's not really such a thing as a life devoid of stressors, just being an organic machine with a finite timeline. There's a lot of physical and metaphysical and mental stress that goes along with that, and that ties in with the spirit pillar of health. But learning how to make that stress feel good, just like you can kind of learn and teach yourself the habit of making the pain of lifting a weight feel good, that can be done with life in general as well.
Yeah, you definitely don't want a zero stress life. If someone has zero stress from, say, the age of 10 onward, they're not going to build up resilience. And you do want to be able to handle stress and be resilient, and choosing stressors that will foster that. And there's overlap in my mind between stress in our next pillar of health, sunlight, because we need to be spending more time outside, of course, protected from sunlight, because too much of a good thing can be bad. But from a mental health standpoint, especially, things like traffic noise, background noise in cities, those are associated with worse mental health. You can literally put headphones on them and play traffic noises, and their blood pressure goes up. It's a stressor, not a positive stressor. Taking a nature walk is going to increase parasympathetic activity. And take those same people, put headphones on them, play birdsong, they're going to have an increase in parasympathetic nervous activity. We kind of need the reassurance that we're in a safe environment, as opposed to being surrounded by constant threats. And you could argue we're all a little bit wired to be in fight or flight. And we'll talk about why things that can help you adapt to that might be beneficial in another tier. But I think we're all under a bit more stress, and taking some time to unwind and taking a nature walk, even if it's just 5 minutes in the morning, 10 minutes in the morning, that's going to be a really positive thing as far as your stress. Will help with sleep as well. They all kind of overlap with one another. So for that reason, I think spending time outdoors is something that we don't do enough of, and we should do more of. And that's why it's one of our pillars of health.
Yeah, I love living in the country. I love helping take care of the gardens and the animals and whatnot. And things like 1,000 hours outside is a good thing to attempt to do as a family. So, and again, that ties in with social health and spiritual health. We've talked about these in many other podcasts, so perhaps we'll move on a bit. But we should mention when it comes to spiritual health, even if you're completely a-religious, a-spiritual or whatnot, at the end of the day, it helps to know what your metaphysical meaning is, even if it's just being a nihilist. So
yeah, and that's the one thing that we can't really tell someone exactly what to do. As far as these other pillars, we can really give people like intervention, say, hey, do this. And then people are like, well, what do I do about spiritual health? And that's really a journey that each person has to go through themselves, a journey that I'm still going through myself. I think, we all are continuing to grow spiritually, whether we know it or not.
Yeah. If someone seems that they're not at least thinking about their metaphysical health, perhaps they're ignoring it, and that can be detrimental. Then when your physical health declines, all of a sudden you're in a metaphysical crisis at the same time, trying to figure out if you lived a good life or not. So being, thinking about that is a tier, especially because you can do things like that as you're outside, as you're doing your zone 2 cardio. You can stack these things. It's not like you have to sit in a library like a philosopher, or like the Greek philosopher that just sat on a pillar for 2 weeks, defecating on top of it. Dionysius or whatever his name was. But
talking about tax dollars going to good purposes, how about seatbelts? Yeah. Seatbelts have saved a lot of lives. They've saved a lot of people from not necessarily dying, but if they are in a car accident, they're going to be substantially less likely to be disabled, which is good for their health. So We can argue about taxes and say that, for all the tax dollars we're putting in, public health is getting worse, but seatbelts are the silver lining. These have done good. And then we also have helmets here. So don't leave home without it. Wear a seatbelt, wear a helmet, wear both of them. Specifically the helmet if you're on a motorcycle or bicycle, and the seatbelts if you are a passenger or driving a car.
And also specifically on like a bicycle or a skateboard, if you're going more than maybe 5 miles per hour. Or if you're in a dangerous location, or if you're going to get hit by something. So be smart about it. There's a lot of applications for seatbelts and helmets. The last thing in our A tier is therapy, with the caveat, if therapy is indicated, if there is a psychological or mental issue to be worked on.
Yeah, if there is a true mental health issue that has a psychological root, then therapy is a great investment there. CBT, like we've discussed before, is always the right answer. More stress, it's not going to make any health condition better. More coping skills is going to be beneficial for just about any situation.
Mm-hmm.